Dear Dr. Mark Perlmutter, thank you so much for sharing your time with our educators and youths around the world who are committed to service and seeking to advance the consciousness of the oneness of humanity, despite all the challenges and opposition that at times this entails. Dr. Perlmutter is an orthopedic hand surgery specialist, president of the World Surgical Foundation, immediate past president of the International College of Surgeons, and former president of the American Academy of Neurological and Orthopedic Surgeons. For the past several decades, he has worked as a humanitarian trauma surgeon and recently returned from volunteering at the European Hospital in Gaza. Doctor, between you and your colleagues, you were present at Ground Zero on 9/11, Hurricane Katrina, the Boston Marathon bombing, and the 2010 earthquake in Haiti on the first day of these disasters. Together, you have worked in the horrors of the war in Ukraine and on more than 40 surgical missions in developing countries on 3 continents throughout several decades of volunteering. This long experience taught you that there was no greater pain as a humanitarian physician than being unable to provide needed care to a patient. But that, you say, was before going to Gaza. Now you know the pain of being unable to treat a child who will slowly die, but also alone, because she is the only surviving member of an entire extended family. You wrote, "We have not had the heart to tell these children how their families died." In the same article, you said, "We walked through the wards and immediately found evidence of horrifying violence deliberately directed at civilians and even children. Overwhelmingly, your patients were children. 70 to 75% of the people you operated on were elementary school-age children or younger. Healthcare providers were also distinctly targeted. 200 ambulances were destroyed along with their paramedics, and more than 480 healthcare workers have been killed. In the face of so much human misery, you call us to action, reminding us of Polish poet Stanislaw Jerzy Lech, who says, "No snowflake in an avalanche ever feels responsible." You say that as Americans, we must acknowledge that we are responsible for this crime against humanity, now in its 7th month and unfolding in full view of the entire world. But you also went to Gaza as an individual snowflake, risking your life to try to slow down this avalanche of death and horror. Dr. Perlmutter, could you share with us how your upbringing has shaped your belief in extending solidarity to every human being, regardless of their origin, background, and beliefs?
Sure. I mean, as I saw the questions that you presented to me, I immediately reflected back on my parents. I was blessed to have not particularly uniquely loving parents, but ones that really taught me the value of community service. My father was a podiatrist in our very small town in southern New Jersey. Everybody called him Doc. Everybody called on him for non-podiatric medical advice, which he freely gave across our kitchen table when they invited everybody over. And that respect that he got and the openness that he treated people, even without the ability to pay, really is what guided me. And I can't really think of another reason why, other than just the instilled importance to take care of your neighbor. When I went through medical school, and I don't think you have to be a doctor to have this type of transition that I'm about to explain. In fact, I'm blessed to be a doctor, but I don't think I would have been much different had I not been. There's billions of ways to serve. Look at Jimmy Carter after he was president. He held a hammer and built homes for poor people, right? Something probably no other president has done. Um, Certainly not the last two. Um, and and may never happen again. So the capacity to serve has nothing to do with being a physician. But I did leverage that for what I do, obviously. Um, and I'm convinced that if I wasn't a doc, I have no trouble grabbing a hammer and helping, build homes in the same countries that I travel to, because I never traveled any place where I didn't see the need for unskilled workers and other skills, workers with other skills, uh, to help those same societies that I helped medically. Um, my own story is that I did my hand surgery fellowship in Miami, which serves the Latin Basin. And when I was exposed to people from Ecuador and other Latin American countries coming up that had the means to pay the University of Miami to do things, they would share with me that there's hundreds of thousands of people back in their country that can't afford to fly in to Miami. They had no means. And so in that year of my training, I went to both Ecuador and Mexico and started my overseas mission work even before I was in private practice. Um, um, my ex-wife started an adoption agency to help uh, bring orphan children from Mexico to the United States, and she was wonderfully successful. As a perfect example of how a non-medical person served, she placed many orphans, into the United States, into loving homes that would otherwise never have left an orphanage. She she was there with me, and we actually were there together adopting one of those orphans, um, and her heart is like 20,000 times bigger than mine. God bless her. And um, uh, and she served in many ways way better than I did in Mexico. Um, and her heart has never gotten smaller. So so that's probably the best example of how you can just go to a situation, see the how you're needed, and make it happen. And she worked diligently to make that a success story. Um, and then so my personal story is I was blessed to know how to operate on people, and I can't do much else good in my life except grow vegetables. But 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 and most would say that I don't do a good job with that. But but being a vegetarian, you grow your own organic stuff, right? And so it's really my experience, in my exposures, which I capitalized on, and just ran with it. And my message to anybody would be: know what your skill sets are, know where your heart's at, uh, use the gifts that God gave you, realize that every situation that you can think of that's less than ideal, you're needed to help. Um, uh, I was laughed at by my office when I drove to my office one morning and I looked at the TV that was turned on for the patients to look at, those old big box TVs that your students may not know what the old TVs used to look like, but they look like a giant Amazon box hanging from the ceiling. They weren't flat screens. And I walk in and there was a giant TV on September 11th, and the World Trade Centers were on fire, and I'm listening to my jazz on the way in, so I'm not paying attention to the news until I saw it. And I immediately closed my office and drove to New York. Uh, New York has thousands of doctors, of surgeons. Um, right down the street, there's 5 trauma centers that are bigger than any hospital I've ever worked at. Um, but I knew that they wouldn't be there, right? And so you always have to have the attitude, if not me, then who? Um, when I got to ground zero that night, the doctors that were in that area were essentially trapped. They had no relief. They were dead tired. They needed relief. Even though there were thousands of doctors outside, all of them thought that there would be too many at the site where they were actually caring for the firemen. Um, there was no survivors that we saw. It was just tending to firemen. The same was true for Haiti. Everybody thought there would be an influx of thousands of doctors from around the world, and there were not. Um, there were still not enough of us, even though obviously many countries got there. They were very underserved until the second or third and fourth week there. Um, and then 3 months after the earthquake, the emergency responses stopped. And when I went back a couple times, often I was the only orthopedic surgeon at the hospital. Um, the explosion of interest kind of dies off. Um, and so in medicine, it's important to recognize that your need is there, but you've got to sustain that need. You just don't come in and operate and then leave and not come back again for a year. Um, you have to have an eye on the system that you're dealing with. In medicine, our goal is to teach local doctors how to do it so we can put ourselves out of business at one hospital, then we move on to another hospital. And only then did you really train local people. And believe me, we learn from them as well. But only then do you move on, and that's been our model. The Bible teaches us to teach a man how to fish, um, and the payoff is greater. And 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 there's a version of that in the Quran. There's a version of that in the Old Testament, the New Testament, and I'm sure Buddhism and Hinduism have a good version of that because it's a fundamental tenet of doing well and teaching. And so teaching is the art of giving. I think I'm looking at one right now that understands that perfectly. Um, but no matter what you do in life, you can assume the role of a teacher, because there's always a ton of people who are dying to know what you know, whether it's whether it's how you a better way to build a truss for a house, a better way to dig a well. Um, I took my son to sub-Saharan Africa on his 16th birthday, the young fellow that we adopted from Mexico. And we chose not to go back to Mexico to his orphanage because it was just simply too dangerous. So we went to Burkina Faso instead. Um, and uh, and he learned how to dig wells, right? Because they had no fresh water. And he quickly realized that their wells were 10 feet away from their sewers, um, and 20 feet down, those waters mix with each other. And so he very quickly realized that he has to relocate all new wells when everybody was getting sick. Um, and so on his own, he identified a need, and on his own, he fixed it. Um, uh, but he taught them why he's moving the wells away, right? There was a reason why the local frogs were dying in the fresh water. Um, from the infection, and why people were getting sick. And so you don't, and he was 16 years old, clearly not medical, and he hasn't been since. But he empowered people locally as a kid. Um, and so those are stories that I see. Um, um, you know, that can make things very well. So I'm getting an incoming call that may interfere with this. Let me just send that away. Um, there we go. And the um, and then you had other questions. I'm rambling too much, but you had other questions. Does that answer that one adequately?
That does. Yes, that was wonderful. Thank you. And you were beginning to talk about empowerment too, at the end when you were talking about your son. We were wondering, what is the source of your hope and courage to publicly express this universal solidarity, even in the face of criticism and opposition or apathy?
Well, there's always opposition. For example, when I got back from Gaza, there was no mistake that um, that those who identified me as Jewish were gonna and have called me a traitor to Judaism. Um, I have an impressively Jewish last name. I am actually not Jewish. My twin sister is a conservative Jew. My father was Jewish. My mother was Roman Catholic. We had a choice in our life what we wanted to do. I became Catholic. I'm fairly convinced it's because there was a girl that I thought was the cutest thing I ever saw that went to the Catholic Church, and I didn't probably think the Hebrew girls were as cute. So I think I chose Catholicism on the same basis that most 13-year-olds would make an uneducated decision on. Um, and because religion was not an important thing in our lives. Attending the Catholic Church every day was. My mom was an ultra conservative Catholic. If one other person had a veil that she would wear, mom would have enough peer support to wear hers. And she said the rosary every night. My dad, on the other hand, um, was not a practicing Jew. Um, he was Jewish for sure, and he respected the Judaism, but he did not go to synagogue. Um, and so that was not a major part of our life. But it was enough of our life for us to realize that religion was an open book for us to interpret. Um, I abandoned Catholicism personally and became agnostic only when the altar boys were being raped in the Catholic Church, and there was no legitimate uh, resolution to that. The cardinals from the Philadelphia area were allowed to escape to the Vatican, where they did not get punished if not protected, and um, and then the poverty in the Latin American countries and the wealth of the Vatican I found is diametrically opposed. I actually took my mother on a trip to the Vatican, well, to Italy and to the Vatican, um, as a fun trip. And this was shortly after I came back from a trip to Ecuador, and the dichotomy between the poverty in a country that's almost 100% Roman Catholic and the billions of dollars that could be of artwork alone that could be sold to fund educational um, and healthcare projects for the countries that source that money to the Vatican um, was just a dichotomy that I couldn't sit well with, and I had trouble donating money to a church that was not returning it to people in need. Um, and so you give other ways. Um, and so I'm very religious in my thoughts. I'm or theologic, but I'm not adherent to any one religion. Um, uh, however, those who think I'm Jewish because my last name is as Jewish as you can get, and I've been told my face is. They when I was in Gaza, they was told that they were tell people to look for the Jewish boy. Um, the and I was shocked to find out it was me. um, Irrespective of that, I was um, uh, left with the feeling that uh, in order for me to let me collect that thought again. Um, it my the foundation of my thinking isn't religion. Although I'm religious, um, what makes me believe in God, what makes me religious, and how I hold on to my personal religious beliefs are the same feelings that make me want to share and do things for my community. It's they're not one causing the other. It's not a religious drive that makes me want to do this. It is the same drive in my soul that makes me want to serve, that also makes me realize um, that that's a necessary part of the God that I would like to uh, believe exists. I don't believe there's a difference between Allah, Yahweh, Christ, Ra, or Buddha or anything. I think they have different names and they have different cultural perspectives. Um, But I think there is a deity that goes by different names depending on the culture that has named him and their experiences. Um, and so I minimize the differences between cultures based on religion. Um, and that makes it easier to go to countries and serve. There is no difference to me between a poor person in Honduras or a poor person in Gaza. I knew that I was needed in Gaza, and when I got there were a scant few orthopedic surgeons. Knowing that the world would be pouring in supplies, I suspected that they would not be pouring in orthopedic surgeons, and they had not. Um, and that's true for every medical discipline, and it's been true for every place I've ever gone. And it would be true for carpenters, and it would be true for plumbers, and it would be true for heavy equipment operators, and nurses, and postal workers. Um, um, you know, Anybody who has any skill set or no skill set, you're always needed in a place that has less than you do. And so um, so, and I saw people who were lay people who were traveling, and they often did way more in terms of contributing to the health of the areas that we go to than any of the doctors did. So, um, so I think I may have answered your question.
Yes. Yeah, that was beautiful. Thank you. And how do you think the youth can remain hopeful and practice the courage to extend solidarity to every human being in their daily lives?
Well, you have that. I mean, hope is the only thing that drives it, right? If you look at the Israel situation, it's my prediction that Palestinians will remain oppressed until my generation loses its power and your generation assumes control, right? It'll be a generational change. Um, that's what I saw in my youth when I was your age in South Africa. In South Africa, it was an apartheid state. For those who don't know what that means, please look it up. But basically, I'm white, I'm more powerful, and you're not, and you will not own land. You will never gain control. I will always oppress you because I will make money off of you. Um, and you won't have a vote. You won't be able to control your destiny. Um, and that's an apartheid colonial type state, and that's exactly what Gaza is now. And it's going to be a long time before that changes. It'll be your generation that makes that change. And if you look at student protests, um, that's exactly what's happening. It's your generation that's saying, no mas, this is not good enough. Um, they're not um, destroying property on purpose. What they're saying is, I'm part of a government now. I'm over 18. I'm a voting bloc, collective voting bloc. And we're telling the government that we don't want to invest into a war machine that's committing crimes against innocent people. Um, Whether you call it genocide or war crimes or ethnic cleansing, it has never been an Arab versus Jew thing in Palestine. It's been nothing more than a land grab, so that the land that belongs to Palestinians becomes now possessed by, the Israeli government inhabitants, um, and only with pressure from your generation will that stop. The same way that South Africa now is not an apartheid state. And the beauty of what's happening in Gaza, and I don't mean that that's a beautiful situation, but politically, the most beautiful thing that's happening is it's South Africa that raised the complaint to the International Criminal Court and the International Court of Justice. It's South Africa that stood up for Palestinians at the UN. It's still the United States that vetoed it, right? We're very ugly to the world by vetoing Palestine becoming a free state a couple of weeks ago, um, when the entire world practically voted for that to happen. And they gave a baloney reason for it. But all that aside, it was the beauty of it was that it was once the ugliest, most racist state when I was your age, the most racist state in the world became the most beautiful country in the world by opposing the disease that they once were guilty of. So there's the hope and change. And that's why it takes a generation. But that's why it's important to invest into that change, because without younger people saying, we've had enough of this, it's not going to happen. My generation, my generation has accepted. Everybody accepts their compromises in life. Life's full of compromises. Everybody accepts them and they learn to live with them and they say, okay, this is the way it's always been. We always need fresh eyes, fresh younger eyes, or different eyes to say, this is ugly, this isn't right. Whether it's the lack of health, in my case, whether it's the lack of health care in San Pedro Sula, Honduras, or whether it's the lack of ways to place orphans, out of Toluca, Mexico, on Karen's part. Um, there's always Karen, my ex-wife. Um, um, there's always a situation that needs to be identified, and younger eyes or different older eyes need to brave up and say, I need to be part of this change.
Mhm.
And that's why I applaud the college students that are protesting. That's the most amazing thing in my life right now.
Yes, you're right, for sure. Thank you. And lastly, we were wondering, how do you think educators can help youth develop a sense of belonging to one human family
Well, okay,
and
well,
stand up for Yeah.
educators is a pretty broad term, right? So, um, educators, well, there's different classes of educators, like there are different classes of everything, right? Um, so there is no one single group of people called educators, because educators individually have their biases and prejudices. Um, and some, for example, look at the educators that are the administrators of colleges that are repressing the students, right? Look at the educators, which are perhaps called the board of directors of Columbia or NYU or USC, right? Are those truly open-minded educators when the valedictorian of USC, who happens to be an Islamic woman, is not allowed to give her commencement speech? Who actually just was awarded her doctorate in genocidal studies? um, and she's not allowed to speak because they're afraid she's actually going to speak to what they just gave her a doctorate on. They just granted her a PhD in a program, but we're too ashamed of you to let you speak to it. They have no trouble letting Seinfeld, the comedian, speak at Duke, but they have trouble letting their valedictorian speak at USC. That's embarrassing for educators to assume that role. Um, and so it's insensitive for letting Seinfeld to speak, and it's insensitive for not letting your own valedictorian speak. So educators need to be educated that education should be free and open without bias. That's what the purpose of a university is. A university's purpose is to let students learn from each other, learn from mistakes, commit mistakes, learn from them, and voice your opinions collectively. And the educator should say, well, let's analyze that together. Is it the right approach? I'll debate you on it academically. And if you can defend it, fine. If you can't defend it, then you should open your mind up to change. That is the non-sterile environment that an educator should promulgate. Instead, they're not doing that. They're afraid of the social sequela. In this case of the Palestinian issue, they're afraid simply of being labeled anti-Semitic. And so let's shut down the system, even though we are and abrogating our responsibility as educators. Um, because we don't want any negative feedback because of an issue. So now that's one level of educators that's really blowing it today, right? So my advice is learn what it's like to be an educator again, you know, to them. To other educators, like your mom, keep your mind open. Teach people that the purpose of education is to have an open debate. Learn the other side. Learn your quote unquote opponent's position. Be sensitive to where they came from. When I, for lack of a better term, have an argue, it's really an academic discussion with my conservative Jewish friends who need to be schooled about the accurate history of Israel's role in managing the West Bank and Gaza. Should those discussions do not end up in explosive walkaways. They end up in very careful, well, if this is true, then what happened here? Let's dissect this apart. We're very academic about how we approach this, and that's the purpose of an educator, is to stimulate that dialogue, is to steer the student towards the controversy, not run from it. Because life is full of controversies. And you become a better student. Well, first of all, you never stop becoming a student, but you become a better student during your training years and throughout life if you learn how to approach every situation as if there are two sides, because there are always two sides. You have to see from where your opponent is coming from, opponent meaning opponent in a debate situation, where they're coming from, become sensitive to what their needs are. And if you still think they're wrong, to do so in a decent and respectful way. And that's the art of education. It's not I'm up here and you're down here. This is the way it is. I'm going to teach you this, and you learn it. You vomit it out on a test, and if you were able to replicate what I taught you, then you get an A. That's not the purpose of education. That's rote memory. That's not learning. And so the role of an educator is to teach that there are several sides to several situations, to any single situation, and your job is to teach them how to dissect, not show black and white, but every shade of gray, and to look for gray because it's always there.
Thank you so much, Dr. Perlmutter. This was very inspiring, really. I'm feeling that I have to leave. I am in Miami right now, so leave to Miami, leave our town and do so. It is so beautiful that you are encouraging us to look at the talents that we have and serve, and that anywhere, even when we think service is not needed, there is a need for people to roll up their sleeves and work.
That's absolutely true,
Yes.
regardless of what your skill set is.
Yes, thank you, Karen.
Thank you so much. It was wonderful hearing you speak.
Thank you. Thank you for letting me help.
Thank you very much.